some people are far more likely to develop high blood sugar than they realize. And the tricky part is that risk can build up long before symptoms become obvious. In this video, we'll look at who is at higher risk and when it may be time to get checked. Being high risk does not mean you definitely have diabetes. It means your chances are higher than average. So screening and early action may matter more. This is especially important because prediabetes often has no clear symptoms. One of the biggest risk factors is being overweight, especially if there is extra fat around the abdomen. Extra body fat can make the body less sensitive to insulin. This is called insulin resistance. And when insulin does not work as effectively, blood sugar is more likely to rise over time. Age also matters. The risk of developing type 2 diabetes increases with age, especially after age 45, and it rises even more after age 65. Family history is another major factor. If you have a parent, brother, or sister with type 2 diabetes, your risk is higher. It does not mean you will definitely develop diabetes, but it does mean you should pay closer attention. Another major risk factor is physical inactivity. If you sit for long periods, exercise very little, or have a mostly sedentary lifestyle, your body may become less responsive to insulin. Regular movement helps the body use insulin more effectively. In general, adults should aim for at least 150 minutes of moderate intensity activity per week. Prediabetes is another important warning sign. It means blood sugar is already higher than normal, but not yet in the diabetes range. And the tricky part is that many people with prediabetes feel completely fine. Prediabetes raises the risk of type 2 diabetes, heart disease, and stroke, and it often has no clear symptoms. For women, a history of gestational diabetes is also important. Even if blood sugar returned to normal after pregnancy, future risk can still be higher. PCOS, or polycystic ovary syndrome, is also linked to a higher risk of abnormal blood sugar, and some metabolic problems, such as fatty liver disease, can raise risk as well. Risk is also higher in some ethnic groups. In the United States, the CDC notes higher risk in African American, Hispanic or Latino, American Indian, Alaska Native, some Pacific Islander, and Asian American populations. An oral glucose tolerance test, or OGTT, can also be used, but it is usually less convenient. It requires fasting, drinking a glucose solution, and waiting for repeat blood tests, so it is often reserved for more specific situations. In general, an HbA1c below 5.7% is considered normal. A result from 5.7 to 6.4% falls into the prediabetes range, and 6.5% or higher is in the diabetes range. If you do not have symptoms, abnormal results often need to be confirmed with repeat testing. Being high risk does not mean panic, but it does mean paying attention. Early screening can help catch problems sooner and give people a chance to make changes before diabetes develops. Subscribe for more evidence-based health information.